Hey, before we get into today's show, a quick word about this show's sponsor. Our sponsor today is Accelerated Health Products. They have some amazing products, everything from immune support, gut health, energy and performance, detoxes and cleanses, women's health, men's health, kids' health. If you like to be healthier and you like products that actually work and actually products that I take and my family takes, then go to acceleratedhealthproducts.com. Use the customer code HealthMadeEasy15 for 15% off of your order. Again, that's HealthMadeEasy15 for 15% off of your order. Now to today's show. Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. This is your host, Dr. Jason Jones, and today we're going to be talking about how to take back control of your blood sugar levels. Now, listen, the digestion of carbohydrates and other foods yields sugar or glucose, which is carried in the form of glucose through the bloodstream to the body's cells. Now, glucose serves as a source of energy for all the cells of the body, and the unused sugar or glucose is mainly stored as glycogen in the liver. Now, when you eat high sugar, starchy, and low fiber foods, especially in excess, it causes your blood sugar levels to rise quickly, and this produces a strain on your blood sugar control because the normal blood sugar should be somewhere between 70 and 110 milligrams per deciliter, or basically when you do your blood sugar test, between 70 and 110. Lower is better. Now, when the blood sugar or blood glucose falls below that range, you get into a condition called hypoglycemia, or basically too little glucose. And when it rises above this limit, it can be normal if you just finished, eating within 2 to 3 hours. Now, that's the main reason why doctors always measure blood glucose while you're fasting. However, glucose levels, show to be below 180, after eating, and anything above this level is termed hyperglycemia or too much sugar. Now, if after taking, a sugar water drink or a glucose tolerance test, your blood sugar measurement reads above 200, then you can certainly be diagnosed with diabetes. Now, these numbers may change depending on the time you listen to this podcast, but for the most part, those are like your reference ranges. Now, how does the body respond to high blood glucose levels? Well, as your blood sugar levels rise after a meal, the beta cells of the pancreas secrete insulin, and that's a hormone that moves glucose out of the bloodstream into the cells of the body to be burned for energy. Like we talked about before, insulin is like a key into the cell, and this helps keep the blood glucose levels normal. Now, a decline in blood sugar or glucose is commonly seen during fasting or exercise. It causes a reduction in the level of insulin in the bloodstream, and at the same time, other cells of the pancreas produce what's called glucagon, which is a hormone that stimulates the liver and muscle cells to release stored glucose in the form of glycogen as well, but it also helps you burn fat for energy. Now, other hormones like cortisol and adrenaline from the adrenal glands are produced if the blood sugar levels fall too sharply, and these hormones stimulate a fast breakdown of stored sugar, so it produces the energy that a person needs during a time of crisis, or just when it just drops, the body just produces that so that, it just brings it back up again. Now, all these hormonal mechanisms work together to control blood sugar levels within a narrow range. Now, with insulin working to allow the body cells to get enough glucose, and the liver preventing the blood sugar levels from getting too low, the blood sugar can stay within a healthy range. But it's quite unfortunate that a lot of stress on these control mechanisms throughout a stressful lifestyle and diet can lead to imbalances, which can lead to things like diabetes, obesity, and other disorders related to blood sugar regulation or dysregulation. Now, a delicate balance of the intestines, pancreas, and brain and adrenals are important to help keep blood sugar levels in an optimal range. So basically what I'm saying is, like, there's a symphony of different organs that are playing all together to help get this correct. It's not just a pancreas thing if your blood sugar levels are not quite where they need to be. So Knowing all of that, our body works really, really hard to maintain a healthy life. Two hormones, insulin and glucagon, are critical for controlling your blood sugar levels. But again, remember, if you can control your blood sugar levels and get insulin to kind of get out of the way, then the body will naturally produce glucagon to be put into play. And it is the primary hormone that will help release stored fat for energy, which you will burn longer, give you more energy, but also help you burn fat if you're trying to lose weight or you're trying to get lean or anything like that. So I hope this helped you out. Any questions, shoot them over to our Facebook page, Health Made Easy, Dr. Jason Jones, and we'll see you on the next podcast. Bye-bye.